Welcome, everybody. We're going to have a discussion today about food-borne diseases transmitted by parasites. This is really an interesting thing for me because when I was a little kid, my mother used to say, "Don't eat raw pork, you'll get trichinosis," or "Be careful where you walk barefoot, you're going to get worms." And she worried because I was a scrawny, skinny little kid that I had tapeworms. And the idea of eating sushi, she would have had a heart attack if she thought we were eating sushi. And it was really interesting because she didn't know really about viral causes of foodborne diseases. And I think it was because back in those days, home economics taught people about these parasitic diseases. Nowadays, if you find parents around the country who know about parasitic diseases versus bacterial diseases like Salmonella and E. coli, it's probably very, very rare indeed. But the parasitic diseases haven't gone away. They're still really important. They're important around the entire world. So today we're going to have a discussion by three leaders in understanding of transmission of foodborne disease by parasites. Karen Shapiro, she is at UC Davis, where she is an associate researcher in the College of Veterinary Medicine. She has a PhD and a doctor of veterinary medicine. Jorge Gomez-Marin, a PhD MD. He's the Dean of the Faculty of Health Sciences at the Universidad de Quindío in Colombia. And Ynes Ortega, who is a PhD MPH, and she's an associate professor in the Center for Food Safety and the Center for Tropical and Emerging Global Diseases at the University of Georgia. Welcome.
Okay, thank you, Stanley, for this opportunity to speak about the parasite. As you say, it's very few know what is the risk with the food and the parasites. But indeed now is a change in the perception of the risk, because with the new molecular methods, they are now showing us that the parasites are present in the food. So now we are each time more aware about the importance of the parasites on the food.
So if there's more being detected, are we also seeing more maybe chronic disease or disease that's just not recognized early on?
Yes. The problem with this parasite disease, that are confused with another virus or even bacterial disease. But when you do the diagnosis with a specific test, you can see that a lot of febrile illness are due to these parasites. So it is important to think about the parasite etiology, because it's the only way to detect. And many of these parasites need of a specific coloration, for instance. When you study the stools, for instance, for Cryptosporidium, if you don't do the Zillnism staining, you don't see the Cryptosporidium. So for us, for the parasitologists, was very important the GEMS study. Maybe you have listened, it's a Bill Gates sponsored study, it's a global enteric pathogenic studies, and they found that Cryptosporidium was the second lethal disease for children. So even for us, for the parasitology, it was a surprise, a big surprise, that Cryptosporidium had an impact as large as this, the second cause of death for children. So now I think it's very important to think about parasites on the food.
So in that case with Cryptosporidium, is it largely transmitted by water or by food?
I think in equal part, because in water is the most important pathogen that we found when we study the environmental samples for water or treated water. The most prevalent pathogen parasite is Cryptosporidium, but in food also, in vegetables, is also very frequent to find the Cryptosporidium.
So Ynes, you're specifically speaking about vegetables and fruit and transmission of these diseases. The interesting thing with many fruit and vegetables is you don't have the benefit of heating them to a critical temperature that would kill the pathogen. So what's the solution with fruits and vegetables?
Well, we have several aspects of this situation of parasites in fresh produce. We know that, for example, Cyclospora, we've had several outbreaks associated with berries as well as salad greens or herbs. So some of them you can actually cook, but a lot of them you can't. So the solution for this is mostly prevention. Prevention in the field, making sure that there are good agricultural practices that are preventing the microorganisms to get into the fresh produce. Of course, if you freeze it, it's all taken care of. But again, if you have a product that is already contaminated, then we have a problem trying to eradicate it. Even there's a lot of wash solutions when we're talking about salmonella or any bacterial diseases. But in the case of parasites, these chemicals are not effective. So we need to definitely consider the prevention more than anything else.
So freezing is a very effective way of killing a variety of these parasites?
Yes, for some of them, and of course it's not the freezing, the short freezing, but you need to keep it for a few days frozen. These parasites are eukaryotes. So basically, when you freeze them, you will kill them.
So this is really interesting because of the recent evidence that Trypanosoma cruzi sometimes is transmitted by berries instead of by the bite of the insect host.
Yeah, well, the Trypanosoma cruzi has, in the past years, we've had evidence that it can be transmitted by drinking juice, which it hasn't been prepared properly, and the insect, the reduvidium, somehow made it into the juice, or the excrement of the reduvidium made it into the fruits. And of course, it was ground and it's not pasteurized. And so when the person consumes it, the parasite can actually cause the illness. Yes.
So I think that Trypanosoma cruzi also is really an important example of some of the long-term impacts of these parasitic diseases that many people who work on infectious disease simply aren't aware of. Could you comment on that?
Yes. One of the challenges with Trypanosoma is the long-term effect. You can tell that after many years, a person can actually develop symptoms. And the problem with that is when you consume a contaminated juice, you may not have any clinical symptoms. It may be later, years later, then you start developing symptoms. Unless it's the product is heavily contaminated. So again, as we look at the significance of this parasite as a foodborne pathogen, we have a lot to learn from it. We are at the beginning of this parasite.
It's important for travelers to be aware about the risk of Trypanosoma. In Brazil, it's related with the acai palm. It's an Amazonic fruit that comes from a palm. It's very used in Brazil, so it's caused a very important outbreaks. In Colombia, for instance, also we had one outbreak that happened in a family that drink orange. So in Caracas, there were many outbreaks related with watermelon, and guava fruit. So it's important for travelers to be aware about the risk of consuming fruit during his travel in South America.
So Karen, what about seafood? We've talked a little bit about meat and a little bit about vegetables and fruit. What about seafood?
Yeah, what about seafood? Do you guys like seafood? Yeah. Do you like to eat oysters raw? Yes? No? Yeah, so seafood has a lot of the same concepts, problem, and findings that we've been discussing here. In produce, for example, if we don't look for it, we don't find it. If we start to look for it, we find parasites, and specifically the parasites that we're focusing on, and we're going to talk about at our session tomorrow, the seafood, parasites in seafood session are protozoan parasites. So the biggest ones you probably heard of are Cryptosporidium, Giardia, Toxoplasma. In the 20 to 30 studies where we look for them all over the globe, we tend to find these parasites. And it's especially surprising in light of the fact that for some of them, like Toxoplasma, the only animal that can produce the environmentally resistant stage are terrestrial animals. So for Toxoplasma, this is cats. So somehow there's enough fecal material and fecal pollution being driven into coastlines, marine ecosystems, where shellfish get exposed and concentrate these parasites in their tissues. So yes, I do think it's a problem. I think there's still a lot of gaps in what we know and what we don't know. But I think that there's reason for us to think about parasites in our food. How do we prevent it? Number one, how do we prevent it? If it's there, how do we protect ourselves? Cooking. I love to eat oysters raw, but I try not to. I usually will cook them to a certain temperature. One thing that is good to know is steaming oysters. They say steaming oysters is safe until they pop open. Well, it really isn't, because the flesh of the meat, of the oyster meat, needs to be at a certain temperature for a certain amount of time. And when you just steam it, it doesn't actually reach that temperature. So they have to be thoroughly cooked. I know that takes away from the flavor, but if you're particularly at risk, pregnant, immunocompromised, it is very important to cook shellfish thoroughly.
So actually, Toxoplasma is a great example of One Health, right? Where, as you just mentioned, pollution in the environment results in runoff into the seawater, and it really supports that whole transmission cycle that ultimately can also infect humans. So I think what you said is really interesting, because that's a case potentially where if we could reduce that flow into the water, we could dramatically impact the disease without any special treatment.
Yes, and that's very tricky when you talk about cats, right? So Toxoplasma in some aspects is easier to discuss because there is that single host or host family, felids, cats, domestic and wild. Cryptosporidium and Giardia, of course, is more challenging. There's a wide range of hosts that can shed it, pets, livestock, people. In theory, yes, controlling cat feces should be easy, right? But it's not at all. It's quite challenging to reach diverse audiences, including scientists, but also including very avid cat lovers, and I'm one of them. I love cats. I had cats most of my life, but passing on the message of domestic cat management is very controversial, very political, very challenging, not just for our group, but also for groups that look at One Health problems like the problem of cats preying on native birds and rodents, and we're getting way out of the topic of parasites in seafood, but this is a One Health problem indeed. And so it goes to the root of domestic cat ownership, but it also has to do with bigger issues like how do we build our cities? Where do we build our cities? What do we pave? What do we not pave? What habitats do we conserve? Where do we focus these efforts? And just another comment that it's not just people in this case. Toxoplasma as well as Giardia and Cryptosporidium affect aquatic animal health. We've seen deaths in marine mammals, especially due to Toxoplasma, but also due to other parasites that come only from terrestrial animals like Sarcocystis neurona, which comes from opossums. And we've done a lot in our coastal cities to make cities very nice habitats for opossums to the degree that they didn't used to be maybe a century ago.
That is the reason of the success of Toxoplasma, because it has a large number of intermediate hosts, and it persists all the life long. So we don't have drugs to eliminate. So now there are very serious concerns about the reason, the mental health. So there are now many studies associating with the schizophrenia, depression. So it's time we discover a new consequence of the Toxoplasma chronic infection. So it's a parasite that is very important now to work into try to find a new medicament, a new drug that can eliminate this chronic infection.
So, Jorge, you worked on the WHO panel that played a key role in defining parasitic diseases that are most important and some of the ways of defining impact of parasitic diseases. Could you comment on that?
Yes, and one of during the discussion at the FAO organization, was very important to estimate which were the consequences, the economic consequences. And so in this global market now, that is a problem for the free trade agreements, because now the sanitary restriction becomes very economic important barriers. So for all the countries, it's very important to define which are the safety measures to get safe food. So what is the most important task and we had is to develop the technique that can determine which food are safe. So that is a big problem in parasites, because with the method we have at currently, we can distinguish which are the food that are infective. You can say that the food is exposed, and all the molecular methods can detect that the food had a parasite, but its infectivity is not possible at this moment with the current methods that are in use. So that is a very important challenge to develop new methods to determine which food is safe.
Yeah, the other thing that I think we should keep in consideration is how many of you are bacteriologists? Raise your hands. Okay, so there's a difference between working with parasites, viruses, and bacteria. With bacteria, if you have some kind of food that you can think it's suspected to be contaminated with, let's say, salmonella, basically you do your enrichment process, then your selection media, selective media, and da-da-da-da. You can multiply the pathogen, the contaminant, massively. In the case of parasites and viruses, that's not the case. There's very few parasites you can propagate them in the lab in a reasonable way, because there's research ways and there's reasonable ways to do in a diagnostic lab. So you may be able to detect the bacteria much easier than with the parasites. An example is if you have a piece of lettuce that has 10 oocysts, your method of selection of diagnosis must be really good to detect those 10 parasites, because you're not going to get any more. Even worse, it probably will be less. So if you start with 10, you will probably have 5 that you can actually use to test. So that's a big, big challenge.
So, there's one other thing about this, Ines, and that is I made the statement earlier today that it seemed like in the United States and parts of Europe, parasitic diseases weren't as important as they once were, and you quickly corrected me. Could you comment on that? Give us a perspective of the distribution and around the world.
Well, things have been changing in the past years because of the globalization of foods. We no longer eat our lettuce. Well, I'm not talking about lettuces because of the problems that we have right now. We're going to touch about other commodity. Let's say tomatoes. The tomatoes, we don't produce enough for domestic consumption. So we have to rely on other countries that can produce these items. As we cross the board, many times we think, well, food safety in the U.S. is the U.S. We don't care what happens elsewhere. Well, the world doesn't have, the parasites don't have borders, and we have to eat food regardless where it comes from if we want to eat what we want. If you're getting married, you want your raspberries in your wedding cake. It doesn't matter what time of the year, you want your raspberries there. So we had to rely on imports. And the problem with that is that we start going into a new type of agriculture, whether there's the right controls, and the beauty about, well, it's not beauty, but the interesting thing about parasites is that some of them, we're talking about endemicity of certain parasites in certain countries. So if a pathogen is in these locations and the crops happen to be harvested in that time where it's endemic and it's high in the community, the chances of getting the product contaminated are also higher. So again, as we are importing and there's more commerce worldwide, we can see that these exotic parasites, which we never thought we would see them here in the US, are happening. I'll give you a good example. I work with Cyclospora. I've been working with Cyclospora since forever. Cayetanensis is the name of my school, so yeah, you know where the name comes, Cayetanensis. So when we did the discovery in 1992, my professor told me, well, that's great, it's nice, it's an exotic parasite, it's a parasite of a developing country. We did the work in Peru. So he said, well, now we need to work on something else because this is a parasite of a developing country. This is not going to happen here in the US. And guess what? 3 years later, we had our first cyclo outbreak in the US. So yay, but not yay, because there came a new story on this. During those years in Guatemala, USAID was trying to introduce a root crop that could be financially profitable for Guatemala. And one of the crops that was introduced were the raspberries. And it was the perfect weather to grow raspberries. Well, guess what? They started exporting lots of raspberries in the US. And there was the perfect storm. We had the parasite, which was endemic for Guatemala. We had the berries, which was the season to harvest them was when it was the season of Cyclospora in Guatemala. So, and again, in the third component, it came to a location where we have a naive population. And then you have a big outbreak. Since then, we've seen Cyclospora every single year. It can be a high peak or a low peak in the US, but we always are getting Cyclospora. So again, it's very fascinating to see how the international commerce, how these parasites that again are exotic, are coming up here in the world. The other example is very nice, is Sarcocystis, for example. The travelers, if you guys like to travel, well, depending on where you go, we have seen outbreaks of travelers going to the Myanmar islands where they have consumed meats that are not properly eaten. And then they go back to their countries, and then we have a wonderful well, I shouldn't say those words. We have a large outbreak of sarcocystiasis. Okay, so again, it's a small world.
I think that's a common theme that we're seeing with infectious diseases is once this new disease or a disease that wasn't in an area crops up, we just keep seeing it on a routine basis after that point. So it's a really big problem around the world.
Can I make a quick comment based on your question, Ynes? So in regards to parasites not being important in developing countries, I think it's important to remember that the population is not homogeneous, right? So, for example, in the United States, the seroprevalence to Toxoplasma is not that high anymore. I think the latest study was about 12%, a crude prevalence. But in the Nunavut, the Indian, Canadian, and the far north of Canada, the seroprevalence is 60%. And it is quite important, and I think it's important to remember that there's differences in cultural practices, in dietary preferences, geographical, of course. The northern north of Canada is very far from many places in the US. So just a reminder that maybe we think it's slow because we're not really looking everywhere.
And actually, if I have the story right, beluga whales, which are eaten by the native indigenous people in that region, are one of the sources of transmission of toxoplasmosis recently, right?
We don't know that for sure, but we do know that many of the marine mammals, probably most, that are consumed, a lot of times not cooked, are infected with toxoplasma. So are caribou, and we just found it in shellfish in that region. So we don't know exactly, but I suspect that all of these food sources could be contributing.
Maybe one comment about Schwarzenegger law, Karen? Arnold Schwarzenegger, the governor of California. Yeah. Maybe, do you know the law?
I know Schwarzenegger. What about him?
Yes, because he forbidden the kittens litter
The
to
cat
throw
litter.
to the sanitary, something like that. No,
That is interesting. Yeah. So
Because
yes, not so no one should flush cat litter down the toilet. That's absolutely true. But um, an important an important factor to remember is that the typical domestic cat that is being fed cat chow, kibble, and poops in the litter box is not the cat that would be the riskiest to disseminating toxoplasma. So, as a reminder to everybody, maybe some more direct practices would be not to feed feral cat colonies, spay and neuter your cat, keep them inside.
So there are so many things we could talk about relative to parasites. I'd love to have time to talk about. But right now, why don't we take some questions from the audience? If anyone has a question.
So, how safe it is to eat
Sushi.
sushi? Because I I try not to eat it, thinking that
That's
everything
a worm thing. Who
everything
wants
has
that?
Anisakis.
parasites. No,
Anisakis. That's one
Yeah.
of the problems. Usually, at least here in the U.S., it's recommended that the fish gets frozen so the parasite, the worm dies. The problem is that you don't always get that. You can get fish that are fresh and they have not been examined carefully. And it's my understanding that in Japan, the sushi chefs, actually study how to recognize the worms. But even, doesn't matter where you go here in the U.S., if you go to one of the fresh markets and you buy fish, if that's not frozen, you would not be surprised to find the worms. Because again, it's very, very common in fish. You gotta be careful on how you slice it and what you get there.
but indeed, sushi is never safe because the anisakis can be present. So there are some surveillance programs, but it depends on the sea. In some seas, it's more frequent the anisakis than in others, but never is possible to say it's completely safe, the sushi. So I had a big problem with my doctor because she preferred the sushi. I always explain, but nothing to do. So that is a problem.
Yes, Suzanne Barth, Texas. I was there when the cyclospora was a problem, and we had an outbreak in Houston, and it was attributed to strawberries from California, which was erroneous. Do you remember that? And it turned out it was
remember
the
that.
Guatemalan raspberries.
Yes,
and
I
I don't
remember
eat to this day. It's like 15 years ago. I don't eat raspberries ever. They're too hard to clean. Look at them. They're really hard to clean. So I don't eat them. I don't trust them. But it was really sad because it really hurt the California strawberry growers for quite a while. And then a similar thing happened bacteriologically with tomatoes. And I think it was a salmonella that was not from California tomatoes, was from Mexican tomatoes, but they got it all confused. So I wish we'd try to pinpoint where things are coming from and not blame produce that's innocent. But it's kind of hard to do. But
I call it the Spanish influenza syndrome, where you blame somewhere
right,
far away.
everybody blames somebody else. Right?
Well, and I was involved with, maybe you remember me, I was involved with a strawberry situation at that time. That was about 3 years after we described cyclospora, and we knew a little about it. What we did know was that the parasite needed few days before it actually became infectious. When the Texas situation started was, again, it's very hard, and if you look at all the outbreaks, there's very few instances in which the pathogen was detected from the food in question, the item in question. So everything has to do with the epi investigation. And if for any of the epidemiologists that are here, when you do questionnaires and you ask, you have to be very, very unbiased. You should not lead your patient because you will get the answer that you're looking for, but may not be that true. So in that case, that's exactly what happened. Somebody said it's the strawberries, and yes, and the problem was that especially in the food industry, if you say this strawberry is contaminated, you damaged a lot of things.
A lot of-
So you gotta be very, very careful when you say this product is the one responsible for that. You have to have very strong data for that.
Ines, but the producers in Guatemala, they improve their agricultural practice. So now we can say it's
Oh,
safer.
yeah, yes. I eat raspberries every time I can. And there's a reason for that. As a result of the raspberry situation, a lot of the berry growers from Guatemala basically went bankrupt. It's drama. I mean, you could write a book on this because there was death, there was loss of money, there was people moving out of the country. It's a soap opera. But a lot of the growers moved to different locations, and because they knew the experience, they knew how to grow these crops, they actually did very well. And if you go and look at the berry growers now, it's day and night. I mean, you go to any of these farmers, Guatemala hasn't recovered yet. And it's been, 20 years almost? And Guatemala has not recovered completely. If you go to where the fields used to be, still not there. But we know that and the berry growers worldwide, at least the ones that I visit, they do a fantastic job. They know what the risks are, and they take a lot of precautions for that. So I do. The problem with raspberries is that they tell you, and I read the box all the time, it says wash it before consuming it. Who washes raspberries? Okay, if you go to any reception, you go to any dessert that has raspberries, no raspberries washed, because if you wash it, looks like a wet dog, and nobody wants to eat a wet dog, okay? So it's basically whoever, the little hands that harvest are the hands that are feeding you, and that's why it's so important prevention.
So many parasites, so little time.
Yes.
We need to bring more discussions about different parasitic diseases back to the ASM, because I think no matter what you work on, we all learn from these different stories, and ultimately it will help improve people's health and also economy.
Exactly.
So
Exactly.
we want to say thank you very much, Karen Shapiro, Jorge Gomez-Marin, and Ynes Ortega. Thanks so much for being with us today.
Thank you very much.
Thank you.